So, high cholesterol in children. Now that we're doing the studies, we are seeing children are developing high cholesterol, unfortunately, as well as children are developing cholesterol plaques or buildup in the arteries, unfortunately, and that can make them more likely to have heart attack and stroke as an adult. But prevention does work, and so that would be things like changing the way your child eats to be, more fruits and vegetables and more fiber and less ultra processed foods, as well as exercise and doing things to help with inflammation in the body, like improving sleep quality and decreasing stress and things like that. And so now the recommendation is that your child gets their cholesterol checked once between the ages of 9 and 11. And if it's normal, they get it checked again between the ages of 17 and 21. However, if your child has risk factors for higher cholesterol, then it's recommended they get it checked more frequently. And that would be the risk factors would include a first degree relative, so a parent or a sibling, who developed heart disease at a younger age. And so for men, that's male relatives, that's considered less than the age of 55. And for female relatives, it's less than 65 years old, is considered at a younger age, as well as if they have any first degree relatives with total cholesterol numbers over 240, or if your child themselves falls into the obese category by BMI. Even though BMI is not a great measurement, that's what we have. And the reason, that makes a difference is because being obese by BMI can change how your body regulates hormones, and that can change cholesterol as well, cholesterol regulation, as well as if your child has any other medical conditions like diabetes that can impact their cholesterol regulation as well. And so the reason to, find this out is not for your child to be on medication, cholesterol medication, but it's more so that they can start working on prevention as a child, and that will help them, as an adult. And so again, like I said, changing the way they eat, switching out foods for healthier options, as well as exercise and working on sleep quality and stress. All of these things can help, and it's a lot easier to make changes when you're younger, than it is when you're older after you're already having problems. And so finding out, if they have high cholesterol as a child, would be helpful for them so that they can start working on it and making changes when they're younger.